Okay, welcome to Global Health Hangouts. I'll be your host, Rachel Leslie. I'm the Communications Officer at the Center for Innovation in Global Health at Stanford University. I'm joined here today with Maren Shapiro. Maren is a fourth-year medical student at the Perelman School of Medicine at the University of Pennsylvania. She spent the last year doing something a little bit different. Maren took a year off to serve as the Stanford-NBC News Media Fellow, where she spent a year being immersed in journalism and communications at leading media organizations. Maren spent 3 months at the WHO in New Delhi, also 3 months at Stanford University's Graduate School of Business, and just returned after spending the last 6 months in the newsroom at NBC News in New York City. I'm delighted to have Maren here with me today, and we'll now turn it over to her to share a little bit more about this experience. Maren, could you tell us a little bit more about what you've been up to over the last year?
Hi. Yeah, it's been a really incredible year. I mean, I can't, honestly, when I was looking for things to do for a year off, I Googled medical media and this popped up and it was like someone had created my dream fellowship. I spent 3 months in India working at the World Health Organization in their community, how a large public health institution globally communicates their message. Then I spent 3 months at Stanford School of Journalism, enjoying everything that Palo Alto had to offer, and also learning the nitty-gritty of what it means to be a journalist, improving my writing skills, improving my production skills, and making connections at Stanford. And then I finished it off with 6 months at NBC News in their medical unit, where I was really immersed in the newsroom, and we provided all of the medical support for the Today Show, for nightly news, for the websites. I got to do a lot of writing, published about 10 pieces on the website, supported all the news segments that went on that had medical content, helped pitch medical stories, got to keep on the cutting edge of all the new studies that were coming out. So it's really been just a whirlwind of a year, but incredible.
Awesome. Well, that does sound like a really amazing experience. I want to take a step back for just a minute and talk a little bit more about how you became interested in global health. In one of our last conversations, you mentioned you were always interested in travel, but when did you become drawn to global medicine?
Yeah, so my sophomore and senior years in college, I had 2 major spinal surgeries by this incredible doctor at the Hospital for Special Surgery in New York, Dr. Ohenewa Boachi Ajay. And he's originally from Ghana, and he moved to the US, worked his way through med school, became one of the leading spinal surgeons in the country. But his dream had always been to go back to Ghana and be able to provide these surgeries to the people in his home country. And so he started a foundation called FOCOS, where they organize mission trips. So surgeons, nurses, physical therapists, the whole care team from the US flies to Ghana, provides these surgeries pro bono for children in Africa who have really debilitating spinal deformities, mostly scoliosis, some tuberculosis, kind of a little. And it was just such an inspiring story. He helped me so much and changed my life so much. And honestly, those surgeries were what made me want to go into medicine. That then I wanted to be able to give back, and I wanted to be able to do things internationally and help people in the same way that he helped. And so I'm FOCOS, the youth board of FOCOS, and they actually just recently opened a hospital in Ghana. So they're growing leaps and bounds, and it's a really inspiring organization.
That's a really incredible story, and it does sound like an amazing organization. And so you, now that you are on your way to becoming a physician yourself, tell me a little bit more about what drew you to this fellowship. So, how did your experience in the newsroom impact you now as becoming a physician?
Yeah, so my family, my parents are television producers, so TV and media and journalism was always in my blood. And I guess I was the black sheep by deciding I wanted to go into medicine and pursue my passion in science. But I always had, it was kind of second nature to know how communication works, to know how media works, television works. So when I went to med school, I was kind of astutely aware of how people communicate with one another. And one thing I noticed is that in the hospital, we're not great at communicating. I mean, I think a lot of what med school does is it teaches you the lingo of how to communicate with doctors, And in doing that, kind of alienates you from patients. So you learn these fancy words for diseases and for procedures that are as physicians, but alienate you from the patients who don't know what you're talking about. So I really wanted to bring it back and kind of re-explore those basic communication skills. And to be able to do that, I mean, television and writing, that's some of the most simple ways of communicating. You need to know how to say something in a 90-second soundbite or less. And so those skills have really, I think they'll really help me in the future when I'm trying to talk to patients and you only have a couple minutes.
Definitely important skills to have, and I think your patients will definitely appreciate that as well. So, I mean, it's clear that communications are definitely important in a day-to-day practice, but what about beyond that? So, you know, what role do you think communications have in shaping global health policy?
Yeah, I mean, it really is a public health tool. You have the audience there, ready, listening. You have the tools to deliver the message. So now all you have to do is take that health message and format it in the proper way that you can deliver it. So that's kind of what we did at NBC. I mean, the audience is there, they're watching nightly news, we have the production staff, and then it was our job to take that scientific study and simplify it in a way that the audience could understand in a segment, but you didn't lose the nuances that are so important. And so I think it's a way to really educate people and deliver kind of the cutting edge science information, whether it's globally, domestically, any sort of health information. You can really deliver it using these tools that already exist.
Great. Yeah, and so now as you are returning to your last year of medical school and applying for residency and all that comes with it, you're coming with this broad new set of skills and experiences, having spent time overseas and in New York. So how do you think, or has your perspective changed, and is there anything you'll be thinking about differently?
I think you cut out a little bit on that last question. Do you mind saying it again?
Sorry about that. Yep. So my question is really, you know, just coming back to med school and, you know, being back into the medical world, how has the experiences in your fellowship over the last year changed, you know, your perspective? Or is there anything that you'll be thinking about differently, you know, as you go back into medicine? Is that, are you coming through?
Yeah, I mean, absolutely. First of all, I'm so excited to go back to the hospital. I've missed being in the hospital. I've missed taking care of patients. And I think that's been a really great thing for me to learn that while I've had all these diverse experiences and they're so valuable and I appreciated every one of them, I'm a person then for patients. And so that personally was a really valuable lesson that I learned. But then the skills I learned, I mean, when I was in India, in another country, in a country that isn't as developed as ours, that has different healthcare struggles, was really valuable. And in the future, I hope to do practice abroad. I hope to do mission trips like that. And I think I'll be better equipped to navigate that kind of healthcare system after seeing, like, going into a hospital, a local state hospital in India, and seeing what the conditions are like there. Being at Stanford and you know, and NBC together, really honing my journalism skills, honing my writing skills, learning how to be a more succinct, clear communicator. That's going to be really helpful, I think, in both communicating with my patients and then also kind of making a bigger difference and delivering public health messages. While I do want to practice, I think writing is something that you can always do. And it's a great way to get messages out there. It's a great way to get your opinions out there and, you know, make the really important things heard. So I think I have no doubt that I will carry all these lessons I learned with me while applying to residency, my last year of medicine, and then hopefully beyond.
Wonderful. Well, we wish you the very best of luck with that. And we thank you very, very much for joining us today. It was great to have you here. And I think that's a wrap for today's Global Health Hangout. But thanks everyone for tuning in, and we hope you'll hang out with us for another hangout coming soon.